Hey everyone, thanks for clicking on this video and checking it out. Today, I'm going to talk a little bit about Bill 36. This is some hush-hush bill that has been pushed through very quietly. You've hardly seen any coverage on this in the mainstream news, but this is really not a great bill. I mean, when people say, oh, COVID is over, what are y'all talking about? No. This government, which is increasingly becoming more tyrannical day by day, is still pushing mandates onto people and punishing. They are pushing and they are punishing. This government, that's what they do. They push, they punish. They push, they punish. And that is not how things work in a democratic society. And there are a lot of other bills that we need to talk about. The handgun bill, the bill C-11 to squash any kind of independent journalism or any kind of free thought. I think I speak. I think I speak. If you want me to alter how I'm speaking, then I'm not thinking. Bill 36 now. Let's take a look at this report from an American news station called OAN.
Millions of Chinese are taking to the streets to protest their country's harsh COVID-19 regulations, as well as vaccine mandates. Meanwhile, Canada's province of British Columbia is set to codify its own version upon its doctors, dentists, nurses, and other healthcare professionals. One America's Neil W. McCabe has more.
The British Columbia New Democratic Party and its leader, Premier David Eby, are poised to codify in legislation new rules punishing any and all health professionals in the province who are not current with required vaccines, with loss of license, massive fines, and/or incarceration. Dr. William Mackis, a nuclear medicine radiologist and oncologist based in Alberta, told One American News his concerns about the clampdown in British Columbia.
Section 49, for example, makes mandatory vaccinations, that includes COVID vaccines, it makes it a license requirement. So now, in order to have an active license to practice in BC, whether a doctor or a nurse, you will need to have the required COVID vaccinations that the government decides, maybe every 3 months if you need vaccines to keep your license active.
Mackey said another section of Bill 36 authorizes jail sentences for up to 6 months for healthcare professionals making statements that contradict the province's own vaccine information, and also encourages healthcare professionals to snitch on each other.
The misinformation clauses where they encourage other doctors to report other doctors, nurses to report other nurses for COVID misinformation.
Unvaccinated Dr. Robert Johnson is a salmon-armed British Columbia dentist who said the proposed law brings anxiety and fear of what could be next.
There's other stuff in there about fines and prison sentences for spreading misinformation. So I don't know what point I'm going to jail if this carries on. And then there's also stuff about them being able to basically close your practice and seize all your property and investigate you. And so it's pretty draconian.
Corrine Morey is an unvaccinated British Columbia nurse appealing her dismissal. She said her union slow-rolled her and other nurses' appeals to give the provincial government time to draft laws and pass this bill.
So we are a year into the process of representation that the union was supposed to provide for us. They have taken our files and put them on a desk. They are being ignored.
So joining me now to talk more about Bill 36, I'm very happy to have Lindsay Gablehouse with me. She is a medical rep. She is a BC medical rep, and you've worked in hospitals all across British Columbia, Vancouver General, Lionsgate. You're based in the Okanagan. The thing is, sometimes when you Google Bill 36, Bill C-36 comes up, which is completely different. That is a federal, I believe, anti-hate law bill. So this bill, Bill 36 in British Columbia, has not got a lot of attention. Before, healthcare workers and so on were affected in the public sector. Now this is going to affect the private sector. So tell me what you know about this bill.
My main concern about the bill is that it didn't go through proper reading. So it was pushed through the legislature very quickly. It's supposed to go through 3 stages of reading. And at each reading, it gives a chance to really dissect what's in the bill, and specifically, what sort of legalities and challenges need to be addressed, if there's any ambiguities in the bill, anything that should be revised And that should happen at each stage before the next reading. But it was pushed through very quickly.
Yes, and that's the problem, and not given any press and not giving any coverage. And so a lot of people don't understand this bill. But you know, the healthcare workers were pushed out of their jobs because they refused to take the COVID, those that didn't want to take the COVID vaccine. Okay, so that's the public. Now the private, I believe chiropractors, massage therapists, acupuncturists, everybody else, naturopaths, all the people that that work privately, they are going to be affected by this ridiculous bill. I mean, it's totally tyrannical still. So what do you say when people say, oh, COVID's over, what are you guys complaining about? No, they're still doing this to people in the province. What are your thoughts on like how unfair this is?
It's you don't even know where to start with this. It is completely unfair. They're coming after the private healthcare workers. Dentists are included in that as well. And part of this bill is forced or mandated vaccines. So that'll be a condition of employment for a lot of these healthcare workers. And you know, it's a big grab of power, really, because you know, the last few years, COVID was just an early stage of rolling out new policies, new bills without the public knowing. And that's what they're doing here. That's what they're doing in the federal government as well. Our mainstream media is not giving this proper coverage, so the public is unaware. And I think it's, in a way, it's a way for the government to kind of come down on those that, you know, use their rights to what they wanted to put into their body and decided not to get vaccinated. And now this is a way for them to just, the government to seize more control. Yes,
it's almost punishing. It's punishing for no good outcome for the people of British Columbia, because we're the ones, our healthcare gets affected by these terrible decisions. So it was introduced October 19th, 2022, and hurriedly passed into law November 24th. They just hushed and pushed this thing through. So I know that there are petitions, and we can write to our premier, our new premier, David Eby.
You know, we can have faith that there's people that are addressing what's going on, but we need to keep talking about it. We need to talk to everyone, even those in the public healthcare system, because my guess is most healthcare workers and doctors don't even know that this bill was pushed through, because if they miss the one segment that mainstream media did on it, then they have no idea. They might have seen a notice from, you know, some of, you know, maybe the College of Physicians and Surgeons or the Doctors of BC, but I don't think there's, you know, enough attention put on this, on how this is going to affect our healthcare and the kind of power that Adrian Dix has moving forward with a bill like this. It's just completely unheard of. I mean, they can basically go in and request, say, your private records, like from a doctor, the patient private records, without even informing the doctor if, you know, a judge provides the authority to do that. And they can also impose fines of up to 6 months in jail or a $200,000 fine. You know, and these doctors can't speak out against this bill or what the government's doing without those risks of losing their livelihood. So it's not good. This is not what we do in BC. We're so much better than this. We need open dialogue and, you know, bringing in the best of the best. And this is honestly garbage that's been pushed through. Maybe there's some aspects of it that make some sense, but they've been very, very sneaky about it. They only got through about 233 of the clauses in the bill, and there's over 600. So how do you put through a bill and you know, push it through to royal assent when you haven't even properly given it the right process in the legislature?
I don't even, the people that approved it didn't even barely read any of it. And it is tyrannical that people would have punishment, jail time, fine. YouTube or whatever wants you to say these are safe and effective. Okay, fine. YouTube, these are safe and effective. I'll just leave it there, right? But now, we need to write to our MLAs, write to the premier, and push. And people did push hard on this, but they pushed it through anyway. But we can't go down. We can't, you know, just lay down and take this. But I want to know just a little bit more maybe about you and just some of your experiences working in various hospitals in BC. What was it like for you during the pandemic? What were some of your observations?
Sure. Well, I am a former medical rep because I was terminated for choosing not to be vaccinated. I actually had COVID early on and had a positive antibody test, which is funny because in the past, when I'm vaccinated for other things, I worked in the OR throughout BC, so I've had other vaccines. I'm not an anti-vaxxer. However, I've learned a lot more about the vaccine industry and would, recommend everyone be cautious about what they tell us. So unfortunately, I'm not working in the healthcare system anymore. But when I was, last year in particular, before the vaccines rolled out, I worked a lot at Vancouver General, Lionsgate, Royal Columbian. I worked in the Okanagan, and Kelowna and Vernon, Kamloops. I've worked on the island. And what I noticed right away is that the narrative that was being spoken on the mainstream media by Bonnie Henry did not match what was happening in the hospitals. The hospitals were nearly empty. It was a very, very good flu season, barely any flu cases at all. And there was a fear-based narrative being driven in the public mainstream media, where in the hospitals, I could go to wherever I was working and cruise right in. And of course, I follow the proper safety procedures, but I would cruise into Vancouver General and there'd be a long line of family members trying to get in just to see, their own family. And of course, they were denied access to see family.
Yeah.
And, it was interesting because during the pandemic, they made parking free at all the hospitals as well. So from the outside, it looked like these hospitals were full because the parking lots were full, but all the employees were parking in the free parking instead of in other areas where they had to before. So there was a perception of it being, busy and overloaded.
Yeah. So you saw empty hospitals.
And I also noticed that a lot of I did. Yeah. Well, and I didn't see it firsthand in the ER, but I have friends that work in the ER. And I asked, what they were seeing and what was going on. And certainly the narrative didn't match what was being told on mainstream media, and policies and procedures were different at every hospital. So if it was in a different health authority, they were doing different things and they were changing on a weekly, if not daily basis. And I have confirmed reports from people that worked in the ER saying that was happening too.
And here you are, another person that I've met in my life since I've started doing this work, a fantastic, wonderful, capable individual who has now you are not working in the industry because they pushed you out because of this, what I'm going to call the poison apple. And you have met people and I've met people, wonderful, talented people that care about patients in the healthcare system, pushed out of work. So our government is happy to push those people out of work. They're not good enough.
Well, I think it's really important that we talk to our friends and family about it. We don't have to dive deep into it, but certainly just asking if they've heard about Bill 36, if they know kind of what the implications of it are, asking about our current healthcare system and what they think the state of it is in right now. It's important that we just keep talking because there's so much censorship online right now. So we need to have that dialogue among ourselves and we make sure we do it from a place, from our heart and less from our head. We can make a difference if we are all working together. And that's what we need to do in this situation.
Yes, absolutely. Well, Lindsay, thank you so much for joining me today. I'm sorry that you lost your job. I'm sorry I lost my job, but then not really. We move on to do other things maybe that we are meant to do in this life. So thank you so much. All the best. And it was so nice to see you.
Great. Thanks, Anita.
Thanks. See you soon.
You bet.